So it's a great time. The moment when I tell this, that it's a great time, everybody is wondering, oh my goodness, what is great about the time? We are feeling like the 2020 is getting repeated. 2022. Hardly hours after we are celebrating and we are wishing each other Happy New Year, the best of the New Year and everything, the whole world, including the United States of America, the country which the whole world looks forward to, is having nearly 5 lakhs cases of COVID per day. 5 lakhs per day. And this re-emergence of the pandemic, the uncertainty is actually in a different dimension because it has come in the vaccinated individuals and of course faster spreading but mild severe as of now. I'm talking about the Omicron. But what's important here is, as the research on COVID is evolving and everyone is more concerned about the effects of the COVID on various systems, we are thinking that COVID affects only the pulmonary, the lungs only it is getting affected. Okay? So it is all about the lungs than the COVID. But the most important fact is, COVID affects almost all systems of the body. And physical therapists have been issuing some information and sharing among themselves that physical therapy management for COVID. But if you see the evidence for that on COVID patients who really used the physical therapy techniques and they have seen the effect in a randomized clinical trial published on COVID patients, physiotherapy. But all the physiotherapy associations have started giving guidelines for the COVID management. Because what is ultimately important is the problem-oriented approach. It's not the disease-oriented approach. The difference between a disease and a problem, the problem may be the dysfunction or the pathological changes in the body, pathomechanical or pathophysiological changes in the body. It becomes a disease only when the symptoms and that symptoms affect the patient's functional activities. We all have neck pain, we don't go for a treatment. If it stops me from talking, if it stops me from writing, if it stops me from working on my phone or my laptop, then I go for a consultation to a therapist, to a physical therapist. What I am trying to tell is, a functional problem in the human body and physical therapists are trying to explore, understand and enable a better recovery rehabilitation process. Functional recovery based treatment, physical therapy. And for a functional activity, you think that only muscles are working, only joints are working, only nerves are working, only bones are working. You are narrow-minded. Every functional activity depends upon the viscera, the internal structures and their functions. The best example is the change of pulse. What we feel in our radial artery changes with different positions. Why does it change? Because there is a pressure change with respect to the gravity, the heart, and the heart has to adapt to it by modifying its pumping rate. So everything, even breathing also, standing and then breathing, lying down and breathing, prone lying and breathing and side lying and breathing, all are different because there are mechanical forces which influences the visceral functions. But now it's the turn of the millennium to think, can the visceral forces affect the mechanics of the human body? Because physical therapists keep asking me these questions of, do we really need to learn a visceral oriented paradigm, be it osteopathy, which is philosophically from a complementary and alternative medicine field, what is called a visceral manipulation, which is a different parallel stream to the visceral osteopathy, where the primary focus is only the viscera. Of course, they tell about viscerosomatic and somatovisceral, but they actually do not explain the interlink other than the spinal cord segments. Particular segments of the spinal cord might supply musculoskeletal structures. The same segment supplies also the visceral structure. So what happens is, if the problem is there in a somatic structure like musculoskeletal, the pain can be, or the dysfunction can come in the viscera. So patients might have visceral problems, but they may not have a visceral disorder. And the same way, patients having a visceral disorder, the same spinal segment supplies the musculoskeletal tissues. So patients will have musculoskeletal dysfunctions. So understanding this common link, the spinal cord, the osteopaths and also the visceral experts have postulated that viscerosomatic, that is starting from visceral and manifesting in the somatic, where primary is visceral, and somatovisceral, the primary is somatic and then the visceral problem, both the directions. In AOMPT, we have a special news. The next week, the coming Monday, we are starting with the viscerosomatic manual therapy. It's not a manipulation of the viscera, it's the manual therapy, it's an approach, it's not a technique. The difference between technique and an approach: technique focuses on structure, approach focuses on function. And also remember that AOMPT has been the front runner throughout this COVID, and if not, that will benefit the patients. Why a course of VSMT will be launched by the Academy of Orthopedic Manual Physical Therapists. So it's a very important time now to realize that if the viscera there is a dysfunction or a disorder, the fascia that is connecting the viscera, structures that is adjacent to the viscera, they all undergo adaptive changes, and that again are interconnected with the facial network, leading to change in the extension of the visceral structures adjacent to the somatic structures like muscles. The best example is, you have a collapse of a lung and the subject comes with the ribs crowding and scoliosis. Okay? And this is the complication that usually comes after a thoracotomy, a surgical procedure for the rib cage, and lobectomy, any of the removal surgeries. We all know that visceral disorder can affect the body because people having, for example, an irritable bowel syndrome, they have tenderness in the back. They develop trigger points everywhere in the body. We actually think of central sensitization, where the pain is memorized, or the cortical representation of pain has happened in the brain. Central sensitization. The moment when we are evaluating a patient for shoulder pain and we are asking them a question, if it is left shoulder, we ask about cardiac or about spleen. Right shoulder, we ask about the liver or the gallbladder, because they can refer the pain to the shoulder, we know that. But when we are examining the patients with shoulder, we ask them the question, the patient tells, no, I don't have any problems in those organs, there is no medical problems. But when you are examining, you find that the shoulder pain is exactly not reproduced in your common clinical tests, and it's a vague pain. You are wondering actually where it is, what is actually the cause, is it psychological? But you think of central sensitization and you can give the patient graded motor imagery, you can give the patient what is called as the pain neuroscience educations. After that, again you still feel that the vague symptom is there. Intensity is less, but the vague symptoms are there. Patient tells that it's some discomfort, I don't know. Okay. Then you are thinking that, okay, it may be autonomic. So you can give sympathetic slump, a neurodynamic intervention, or thoracic spine mobilizations and manipulations, because autonomic nervous system can be influenced through them, and also relaxation techniques. Is the game over? And you still find that there is still vague symptoms. As a clinician, are you justified in labeling this patient as non-organic until and unless you evaluate the visceral tissues? Because if the visceral tissue examination, you are giving the forces on the visceral tissue, for example, if it is to do with the lungs and if it has to do with the, what is called as the other visceral organs. If I am fixing this left lung, so what is important here is when I am palpating or I am giving forces on this lung, if that vague discomfort can be reproduced in the patient, there you are. You have done justice as a healthcare provider, rather than telling that patient has to go to a psychologist. What I am trying to tell is, the best that we can do for the patients, because they are alive even after all the waves of COVID, the best you can do as a therapist with an obligation as a healthcare provider, you are not treating visceral disorders alone, you are treating somatic disorders with visceral dysfunctions. Maybe the primary is visceral and we need to identify that. Because if there is one visceral disorder dysfunction, it can cause musculoskeletal symptoms in shoulder, chest wall. It can also cause the back pain, upper back pain. Mostly in women, you get symptoms of upper back pain, pectoral girdle pain, shoulder impingement syndrome. Sometimes they even develop the lateral epicondylalgia. Why not the visceral is also there is a dysfunction. That is why all the musculoskeletal structures are getting affected. Also another thing which you have to think is, we advise the patients on mineral nutrient supplements. But are we thinking that which visceral organ is actually important or it's playing a role in the metabolism of that micronutrients? We should think. If it is to do with increased uric acid in the patient's blood, which is causing joint pain throughout, remember one thing, why not explore with the help of a urologist in good communication and doing an ultrasound scan for kidney, for ureter, bladder, urethra, and evaluate viscerosomatic manual therapy. Think and see that we can help these patients if we understand the glory of knowledge that human body is a mystery and we need to evolve more and more better treatment techniques in what is called as in line with the futuristic thinking. We can't think of what is existing now and then learn only what is there now. We have to anticipate that what can be tomorrow. Those are the people who are born leaders. And on this new year, I not only wish you a very, very happy new year once again. Remember one thing, the greatness of the time depends upon how well you utilize it to make everyone around you the best. You have to utilize it to make everyone else the best. You become great automatically. So time has made you great. So time has to be great. So have the best of the times and invest not just the time and money, but also your dreams in becoming the best physical therapist. Enroll in these courses, upgrade your knowledge, learn the best fundamental knowledge, the interlinking the biomechanics, interlinking the pathomechanics and the pathophysiology. Arbitrarily anybody can teach anything, but you need the link, you need the rationale. To know that, your search will begin and also end only at AOMPT. So welcome to the course, the Visceral course. We are having series of webinars, yes, which is going on visceral anatomy in this week. And also we see that there is a Sunday webinar, Splanknology. It is a visceral anatomy. So therapeutic splanknology, anatomical perspective to treatment. How our decision making is influenced by the anatomy. Knowledge of anatomy, how much it's important in our therapy. And it's always important to note, the final point is patients, every structure, every organs are working together, and if there is a dysfunction, there will be dysfunction in all the organs, interdependent. One may be involved more than the other, but every structure is involved. So please do not narrow down your thinking and take your important decision this 2022, whether to be ordinary or to be extraordinary. Good luck to you all. Signing off, Professor Senthil P. Kumar from the AOMPT.